The first ever locally manufactured biosimilar, a breakthrough for the Bangladesh pharmaceutical industry. Incepta Pharmaceuticals Limited has always been a step ahead with its state-of-the-art research and development facilities. The company has always dreamed of manufacturing its own biosimilar molecule. For the last 8 years, the members of its biotech plant have been diligently dedicated in the development of Incepta's first ever biosimilar raw bulk. Towards the end of 2019, Incepta was able to successfully launch PEG-FILGRASTIM, the first ever biosimilar API in Bangladesh. PEG-FILGRASTIM, a granulocyte colony stimulating factor used to treat neutropenia, is manufactured from scratch via various intricate steps. Initially, a master cell bank is created from E. coli by recombinant technology. The master cell bank is stored at -80°C in the biotech plant. Specific cell samples from the master cell bank is transferred to a separate workstation where it is eventually converted into a working cell bank. In order to obtain the working cell bank, first, a luria broth plate is prepared from the master cell bank. Next, a pre-inoculum is prepared by transferring cultured colonies from the broth plate into a terrific broth media. The pre-inoculum is mixed well and its optical density is tested. An optical density in between 0.5 to 1.5 indicates a perfect working cell bank ready for fermentation. The working cell bank is then mixed in a seed culture solution and transferred to a fermenter where the culture is allowed to ferment for 16 to 18 hours. The culture is then subjected to centrifugation where the E. coli cells are separated from the other environmental impurities. Next, the cells are broken down using a cell disruptor and the crude protein is obtained. This initial protein separation is known as the upstream process. The crude proteins are then purified by the downstream process. This process begins with the solubilization of the proteins in a buffer. The proteins are then reduced by a reducing agent and then rightly refolded using an oxidizing agent. Filgrastim is obtained, which is then PEGylated to produce activated PEG-FILGRASTIM. The PEG-FILGRASTIM bulk is purified using chromatographic columns selectively packed in our own facility. The final ready-to-fill bulk is stored below 5°C until commercial production use. Preclinical studies were done with the PEG-FILGRASTIM fill bulk and the biosimilar showed non-toxicity and suitable for further clinical trials. In Phase 1 clinical trial, PEG-FILGRASTIM of Incepta Pharmaceuticals was found to be similar to the innovator brand in terms of pharmacokinetic, pharmacodynamics, and safety parameters. 4 benefits of locally produced biosimilars. High-quality products at affordable price, thus helping to save thousands of foreign currency. Clinical success proven in local patients. Nationwide readily accessible to all patients. creates self-dependency and stimulates further development of local healthcare sector.